are going to see a counselor to discuss a personal issue or conflict you may be having, there are a few tips to consider that will help make the process work for you. Joining us with tips is Dr. Rob Robinson, Clinical Director of Family Care Counseling Associates in Wilbraham. Dr. Robinson, this is an issue that people, I think, struggle with, thinking, I want to go to counseling, but I'm not sure if it's going to work for me, and if I go, how do I know it's going to benefit?
Right. I mean, lots of people make decisions at some point in their life to go see a therapist or a counselor. You know, and a lot of people have a lot of anxiety or nervousness about the whole process. It's not easy just walking in off the street and talking to someone you've never met before. And I think sometimes to grease the skids and try to set the stage for it being at least, hopefully, you know, helpful, is to get a referral from a physician, maybe your doctor, maybe from someone that has gone to a therapist who had some great success with that person, and just so that there's some sense of who the person is before you go. I mean, we do have an awful lot of great therapists in our area, very well-trained people who've been in business for a while. They know what they're doing, but you know, it's just a great idea to get a name from someone who has some experience with that therapist, so that you at least know what you might be getting into before you go.
Right.
It's not the whole picture, but that can help.
And there are many therapists that specialize in certain issues, so you also want to try to find someone that can help you specifically for what you're looking for.
That's a great point. I mean, there's so many different things that, you know, in the mental health area, that everybody has different training in different things, so it's good to ask about that. Do you have training in this? Is this something you're experienced with? Do you treat this a lot? Now,
every therapist has a certain style or a certain way of going about therapy, so you want to make sure that the therapist that you see is a good fit for you.
Absolutely. I think that, you know, it's important, we're going to talk about this in a minute, but it's important to kind of know what you're after when you're going in. But you also know what kind of person you are. You know, if you're the type of person that would really like to be engaged with someone else and get feedback and have it be very interactive and get information from somebody, then you have to plan with that in mind and weigh whether that's being effective with that in mind. You know, if someone just wants someone to listen and sit there and not say much, then that's something that they might be looking for as well. But to be very clear about what type of person you would like to see, so that the match between the two personalities works, because really so much of what happens in any healing relationship is really the relationship that exists between the patient and the provider or the doctor. It's really important.
And we know as a society for a fact that therapy works. It's just a matter of finding the right fit.
That's right.
And making sure that you are doing what you need to do as well for yourself.
That's right. The better the relationship, the better it's going to work.
Right, exactly. So that's what you have to keep in mind. Also, you suggest that people think about when their appointment is before they make it, because they may not be able to go out and go grocery shopping after.
That's true. I mean, depending upon, I mean, sometimes sessions can be difficult just by the nature of what's being discussed, and sometimes people don't think when they're making appointments during the day, you know, how they might feel after they get done processing something that's really tough. So if you have to run off to a business meeting or run back to work, or have to deal with something that, you know, is going to require attention, you might want to just plan to maybe have some space afterwards so you can process what happened and just kind of, you know, recover from the visit a little bit before you go right into another thing. That's not always the case that's necessary, but it's important, I think, to think about that when you're making appointments.
Absolutely, because you don't want to be stuck where you have to go somewhere and you're not feeling ready or up to it. You also want to be clear about your goals and why you're seeking help.
Yeah, I mean, I think it's really important for people to really give thought before they go into their first visit and then subsequent visits. What are they there to accomplish? What are they trying to have? Why are they in therapy? You know, what do you want to have happen? You want to try to establish some mile markers so that as therapy progresses, you're noticing and achieving the changes and the things that you decided to go for in the first place. So it's important to lay that out with the counselor, know why you're there, and know what you're trying to achieve at each session.
And you suggest also collaborating with a therapist, discuss what's working, what's not working, what can we do better to get out of it what they want to get out of it.
Yeah, I mean, I think it really is a collaborative process between the patient and the therapist about, you know, what's working, what might work better. I mean, I know that, if, for example, the new healthcare process in the country is going to be very much quality driven, so it's important even to have a therapist who says, hey, listen, if there's something that's not working well, or there's something, you know, that's not happening, or something you'd like to have happen, I'm open to that feedback. I want you to be able to tell me what you think is important, what's working for you and what isn't, because that just just facilitates the entire process and makes it work better.
And you suggest that people do their homework. You're always left with something that you can work on, and you need to do your part as well.
Absolutely. A lot of counselors, a lot of therapists give homework assignments based on what they're working on, what the patient's working on. And it's really important for people to take that with them, go home, and try to apply what they're learning in counseling so that they can get well more quickly.
Yes. Absolutely. And above all, you want to make sure that it's working, because the goal is to come out better on the other side.
You absolutely want to try to be able to feel better and achieve what you went for there in the first place.
Because we know therapy works. Thanks so much, Dr.
Thank
Robinson,
you.
for joining us.
Great
Always
to be
nice
here.
chatting with you. And for these tips and more, you can always visit us online at mymassappeal.com.